Hi everyone, this is Dr. Jenny from the Hobson Institute, just for a quick reminder of how to wear masks and how to breathe behind them properly. Remember to use a mask that is snug around your face, that hugs your face, not allowing any of this air to leave the area. So you want it to look like it's hugging your face. Notice this shape of this mask is more like a beak. What does it do? It allows your nose space to breathe. Why? Because we want to make sure that our noses are where we're breathing. Beware that masks will make us very congested. If you start to breathe too big a breath, your nose starts to be congested. We need to practice slow breathing. Slow and low. What does that mean? I want you to breathe slower than you're used to, using your nose and getting your diaphragm to work. Your diaphragm is the big muscle underneath your rib cage that is meant for breathing. When your mouth opens or you use your chest muscles, you use these muscles that aren't supposed to be used for breathing. That ends up pulling your head forward and giving you a problem with your neck eventually. One other thing you can try if you're having a hard time with masks is wear a breathe right strip right here, or use a nasal dilator. It'll help open up your nasal passage for you to tolerate breathing with a mask at work. Remember to check your pulse oximeter. If you feel like you're coming down with a cold, these are really small devices that you put on your finger that measure your blood oxygen saturation. COVID will cause a decrease and a rapid decrease of blood oxygen saturation, and that's one way to monitor it. There is a myth out there that using masks causes us to get less oxygen. It's not true. Our body has to be more used to holding on to our breath. That feeling of breathlessness is more your body's sensitivity to holding on to carbon dioxide. We need to practice slow breathing through the nose. So the tips are, I want you to make sure that the mask hugs your nose, that it doesn't compress your nose, that you use your nose. You practice slow breathing and deep breathing in the sense that it's low using the diaphragm. Use a dilator if you need to, and remember to always check your blood oxygen saturation. Buy yourself a pulse oximeter so that you can monitor if your oxygen saturation is going down. Be safe out there. Continue using your mask.